Several parents of medically fragile children are challenging major cuts to nursing support by the Maine Department of Health and Human Services. These children qualify for a program that ensures that vulnerable children get care even when nurses are scarce.
So parents who are licensed nurses can be paid for caring for their own children, which keeps them and their job supporting their family. However, this lifeline for families now faces an uncertain future. News Center Maine's Vivian Lee has more on our story from Gray.
Mason Dahl loves playing with his magnetic blocks and enjoys recess at school.
Ooh, I built the train track.
But the 11-year-old lives with complex health issues. He was born with cerebral palsy and has tumors in his brain and spinal cord that cannot be surgically removed. This ongoing battle has been part of Mason's life, and he is qualified for round-the-clock nursing care at home. However, due to nursing shortages, those hours have never been fulfilled. The family circumstances, though, changed when his mom became a registered nurse 2 years ago.
Go to the table and I'll bring you some blueberries.
Sure.
As a result, Mason was approved for MaineCare's Special Circumstances Nursing. Available to medically fragile kids under 21, the program allows parents who are licensed registered nurses to be compensated for providing skilled care to their children when approved nursing hours are not staffed. But late last spring, Mason's weekly nursing hours were slashed from 80 to 40, just as he began experiencing new and serious complications from his cancer, which required additional medications.
Daily steroids and emergency stress dosing in case he gets sick. One of those doses is an IM injection, and it literally could be his life if he doesn't get that medication in a timely manner.
Ashley says DHHS determined Mason did not qualify for those hours and instead offered a CNA. But CNAs are not able to administer medication.
Here you go.
As a result, she's had to take leave from her nursing job to provide care for her son.
I think it's a way to save money. In their mind is there's a nurse in the home, so they don't need as many. How do you feel when you have a nurse?
I just feel safer, and I feel like I'm a person.
Meanwhile, another family is facing similar struggles. Melissa Hager's 9-year-old son is paralyzed in all of his limbs after he contracted encephalitis as a baby. She is a licensed registered nurse and a nurse practitioner. During Will's recertification with the Special Circumstances Nursing Program late last spring, she described how the nursing agency cautioned her about potential changes.
Be prepared, you're probably going to get denied and you won't have nursing hours, or you'll have less nursing hours to work with. And I would say, I'm sorry, but I'm not training my children to take care of Will. It's not safe.
Because of these reductions, Will's nursing hours were cut, and now both mothers are appealing through DHHS's Division of Administrative Hearings. A decision can take up to 90 days. Regardless of the outcome, both mothers say they will continue to advocate for the care their children desperately need. In Gray, Vivian Lee, News Center, Maine.
A DHHS spokeswoman tells News Center Maine the department reviews each case to ensure that children covered by MaineCare receive appropriate services per MaineCare policy.